Before start, the patient should be at rest for 5 minutes before taking the blood pressure. The patient also needs to avoid caffeine or nicotine for at least 30 minutes before the assessment. For the assessment, we will use a stethoscope. Make sure that ear tips are not facing toward you. They should be away from you. Also, we will need a properly sized blood pressure cuff and a sphygmomanometer. Make sure the patient is seated with the back supported and feet apart on the ground. The arm should be elevated at heart level. Select the proper size of the cuff. Use the index line to determine if the arm falls within the range area. It should cover 80% of the patient's upper arm. Otherwise, choose a smaller or larger cuff. Remove excess clothing that might interfere. Wrap the cuff around the upper arm and make sure to align the mark of the cuff to the brachial artery. The cuff should not be too tight or too loose. Make sure the stem is on by taping the diaphragm of the stethoscope gently. Check the valve of the sphygmomanometer is also closed. Place the chest piece over the brachial artery. Avoid putting your finger on the bell of the stethoscope to avoid sound interfere. Inflate the cuff to 180 milliliters of mercury. Slowly release the air at a rate of 2 to 5 milliliters of mercury per second by switching the valve. Listen with the stethoscope for the first sound. It is called systolic pressure. The last sound you will hear is diastolic pressure. These sounds are Kharkov sounds. Finally, record and measure the blood pressure twice to get accurate values, but wait 1 minute before next measurement. The following table shows the blood pressure category. The normal blood pressure is less than 120 for systolic and less than 80 for diastolic. Prehypertension is between 120 to 139 for systolic or 80 to 89 for diastolic. High blood pressure, stage 1, is between 140 to 159 for systolic or 90 to 99 for diastolic. High blood pressure, stage 2, is 160 or higher for systolic or 100 or higher for diastolic. Hypertensive crisis, where emergency care is needed, is higher than 180 for systolic or higher than 110 for diastolic. You can use this table to see the classification of your patient's blood pressure.